Hi, my name is Kaylin, and this is my EBP evidence-based practice research on peripheral intravenous catheters and outcomes for hospitalized patients. My clinical question in PICO format asked about in hospitalized patients aged 18 to 65, does leaving functioning peripheral intravenous catheters or PIVCs in place for more than 96 hours compared to the standard practice of changing them every 72 to 96 hours increase incidence of phlebitis? So currently, peripheral intravenous catheters are changed every 72 to 96 hours in most facilities with the idea that that will decrease infection and complications such as phlebitis in patients. It's estimated that about 350 million PIVCs are inserted each year, compared to only about 37 million in patients in the hospital system. So that is significantly more intravenous catheters being placed in compared to the amount of patients in the hospital. So a lot of peripheral IV catheters are being used per patient. Standard practice for the last 35 years has been to change them more frequently. However, phlebitis rates are currently 14% to 16%, when acceptable standard of practice would be at about 5% or less per hospital. So that's a pretty significant rate currently with that practice. So looking at the research, I used the Cumulative Index of Nursing Allied Health Literature and PubMed to look for articles. For this particular search, my keywords were peripheral intravenous catheter, phlebitis, and dwell time. And articles from before 2018 were excluded, and I was only looking at US-based research, not international research. I found 7 results on CIN-AHL and 21 results on PubMed. Out of these, about 20 were appraised, but ultimately only 3 appropriately answered the PICO question that I was asking, and they are each listed in the chart here. So what I found through the research was that we definitely need to look into updating our clinical practice guidelines. If we switch from just changing these catheters every 3 to 4 days just because, to allowing nurses to use their judgment of when it's time, looking for the signs and symptoms that clinically indicate that there's a reason to change that peripheral intravenous catheter, you can not only reduce extra painful insertions for patients, which is uncomfortable and causes them more stress on top of the other reasons they may be in the hospital. It hasn't been shown to increase complications like phlebitis or bloodstream infections, and it actually is better for the nurses. It gives them a better workflow. They don't have to be thinking about changing these peripheral intravenous catheters if they're already still functioning and working well without causing problems. Another thing that was found in the research is that with extending the dwell times that they're in place, utilizing antibacterial securement dressings helped extend their time as well compared to traditional dressings, which also helped reduce rates of phlebitis and bloodstream infection. And it was cost saving because you're not using as many supplies per patient. You might, if they have a shorter stay, only need to put 1 peripheral IV catheter in, and you can leave it there until they're ready for discharge. And one last recommendation from the studies was to use what's called lean leadership to create a bundle for practice so that nurses have a guide as to what the clinical indications for these catheters is. When do they need to be removed? When are they okay to stay in the patient for a little bit longer? In conclusion, IV catheters are necessary. We need them for medication administration, but they do put patients at risk for complications, and they can be costly. So updating this clinical practice to changing them only when clinically indicated would be beneficial not only for the patients, but for the nurses and for the hospital system as a whole. My references are listed at the bottom here, and if there's any questions, please feel free to let me know. Thank you.